We are here with Dr. J. Cohen, an OBGYN in Fort Lauderdale. With the exception of medical emergencies, does a pregnant woman have the right not to be induced, and what would be the proper way to ask her OBGYN to only deliver when the baby is ready?
Well, what we've seen a lot nowadays is there's something called induction for convenience. And what a lot of do is that since a lot of doctors are associated with large groups, a lot of the patients only want their so-called doctor to deliver them. And it's common practice for if the patients are inducible, meaning that if the cervix feels ripened, they're somewhat dilated, the baby's in good position, then sometimes elective inductions can be offered to the patients, and the current recommendation for that from the American College of OBGYN is that patients should be induced if they are no earlier than 39 weeks. Patients always have the option, so since their pregnancy and their body, there's always medical indications for induction, meaning if there's problems with the maternal history, if there's high blood pressure, diabetes, some type of medical problems to the patient, the baby's starting to get big, and the patient doesn't want to have a cesarean delivery, and sometimes you can deliver the baby before it looks like it's going to get too large, which may put them at an operative risk. Also, there's indications for inductions to be done if there's a problem with the fetus. Low amniotic fluid, maybe the baby's not growing as well, some type of indication that would tell us that the babies would do better on the outside than on the inside. But in getting back to your question, patients always have, it's their choice, their body, it's the relationship that they have with their doctor. Really, inductions for convenience should not be done. That's between the patient and the doctor, but if a patient is going to be induced, they should make sure that the cervix has what we call a good Bishop score, meaning that it's ripened wells, that puts them at a much better chance for having a nice normal delivery, that they should not be induced before 39 weeks unless there's a medical indication, and also they should talk to their doctor or midwife how they plan on what medications should be used for the induction.
That's great advice. Thank you.